The ongoing fight against COVID-19, the surge continuing through the holidays, the CDC saying Omicron now accounts for a majority of the new cases. We're also seeing an alarming increase in the number of children being hospitalized with coronavirus. For more on all of this, let's bring in Dr. Oren Friedman, ICU Director at Cedars-Sinai Marina Del Rey Hospital in Los Angeles. Doctor, thanks so much for joining us.
Hi, happy to be here.
All right, good. Let's start where you are. California has been averaging some of the highest COVID cases. On December 26th, the Los Angeles County Department of Public Health recorded, they say, 20,821 new infections, nearly reaching the record for highest daily case total for the entire pandemic. So the question for you at your particular hospital is, how has it been going? How are you doing?
So case numbers are definitely up. Hospitalizations are up. But, I do have a bit of good news so far, and that's that the ICU cases have not increased. Probably a little bit too early to know. Does that mean that it truly is leading to severe disease or not? Certainly, we're hopeful that that's the case. We're not seeing the kind of numbers that we saw during our previous surges, and that's really quite reassuring.
That is reassuring. I want to follow up on that because I know a lot of people are really looking forward to the time when health experts can tell us it's not as severe or whatever the data shows out. How long do you think? We've heard a couple weeks, we need more data. When do you think we might be certain that it is not as severe as Delta?
I think we're up at the last sort of 2 weeks that it's going to take to really know. And the reason we say that is because hospitalizations always lag behind cases. Deaths always lag even further behind cases. So deaths lag somewhere in the sort of almost 30-day range. So we're looking very closely to east, back east where the cases began to surge a little bit before us to give us a sense of how things are happening. And so, I've been in very close contact with many of other ICU colleagues on the East Coast, and fortunately, they are also not seeing the kind of cases that they saw during the previous surges. So I think we're pretty close to being able to say with more certainty that it's going to lead to more severe disease, but we're always careful to predict things before we have all the information in, quite yet.
Of course, especially during a pandemic. Across the country, pediatric COVID hospital admissions have gone up 80% nationally over the last 4 weeks or so. And according to federal data, nearly 2,000 children are currently hospitalized. So even as people may be experiencing less severe symptoms, why are so many kids being hospitalized now?
Yeah, it's seeming like that might be a characteristic of this particular strain. I think with each strain, we've had a new challenge. They all behave a little bit differently. They tend to infect different populations of patients. And certainly there is some alarming data that it may be leading to more hospitalizations in children. I still think it's a little bit early to make those conclusions. But we're certainly concerned.
And I just want to check with you. I've heard that a lot of the kids who are in the hospital, hospitalized with this, were unvaccinated. Do you know that to be true?
I don't have that information. I can tell you that we have not seen hospitalizations at Cedars-Sinai. We have seen an increase in outpatient cases. I can say that for sure on the adult side, much more likely to be in the hospital if you are completely unvaccinated.
Following up on that, with millions still unvaccinated in the U.S., should we be concerned? And I know it's hard to say as we're just dealing with the surge in Omicron, but should we be concerned about another variant showing up?
Oh, we absolutely should be concerned. I think we should also be concerned that as these variants are, continuing to change, they're beginning to outsmart our tools. And one of the real problems with Omicron is it is able to outsmart the vaccines better than the previous variants we have seen. So, being just routinely vaccinated is not as protective as it was against Delta. It still is protective, so it still is an important thing to do, but it's not as protective. What we do know about Omicron, though, is being boosted helps a lot. And look, only 17% of the American population is boosted. So if you are, currently considering getting a boost, this is when you should act because this is the time that it's going to make a difference. But absolutely being boosted is important. And absolutely every time this virus infects a new person, it gets smarter and it has the ability to change.
Across the country, urgent care providers and testing clinics like, say, CityMed, which is on the East Coast here in New York City and New Jersey, announced closures because of staffing concerns. We're seeing more people get Omicron and have to call out. Does this get worse, you think, before it gets better?
No, I think so. Because remember, even if we are lucky and it turns out that Omicron does only, create sort of a more mild disease, well, you're still going to be out of work. So as healthcare workers begin to get infected with it as well, they're also going to have to take time off of work, which means it's going to be much more difficult to staff our ICUs. These are the unpredictable things. And remember, it is so incredibly contagious, much more so than we've seen in other variants. It's going to affect the workflow quite a bit.
According to the TSA, as we talk about workflow, more than 5 million Americans have traveled by airline since December 24th. That is up 43% compared to the same three-day period in 2020. That coupled with the surge in Omicron cases we were seeing before the long holiday weekend. Are we looking at a surge on top of a surge? What do you see the next few weeks looking like?
I think that's right. I mean, what we know about Omicron is it doubles about every 4 days. I mean, that's an incredible math, right? So I don't see any way around the fact that we are going to probably see a surge upon surge of cases. But again, hopefully it turns out that it's a milder disease. Of course, you mentioned air travel. The more we can do to protect ourselves, the safer you're going to be. So obviously being very careful about wearing your masks, wear your masks upon, in the airplane, in the airport, make sure you're washing your hands more frequently. All these things work, but in a way we almost have to be more careful because it is just that much more contagious.
Of course, you're seeing breakthrough cases. You're talking about that, especially in adults. But I would imagine your message to America today is the best thing you can do, really the only thing we can do outside of taking precautions, washing our hands, as you just said, is it getting vaccinated and getting boosted?
That remains the most important thing. Get boosted, be careful, wear your mask. This is much more contagious than we've seen before. That's all we can hope for.
All right, Dr. Oren Friedman, ICU Director at Cedars-Sinai Marina Del Rey Hospital out in Los Angeles. Thank you so much for taking the time to work through this with us today. We really do appreciate it.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.